And now.
Thanks for joining us. We're back here on the link. Thanks for joining us. Good morning, Chris,
Right
Jason,
on.
Joseph. How are you all doing?
All right, just here with my favorite Luta face.
Right, yeah. So actually, it's someone at the Guam Memorial Hospital called me a rota face, which is, a compliment. It's
That
a
is
compliment.
I wish I had a rota face.
You do, Chris. Some days.
Some days. Okay, right on. It must be my NMI roots from my grandpa. Okay, it's 8:42. Tomas Maglotnia, you guys, he's doing a great job here with KUAM News. Kind of really cut his teeth reporting on the pandemic from the CNMI during the first wave. Remember that?
Yeah, and someone
Seems like
else who remembers it really well joins
sure.
us right
Yes,
now.
of
The Chief Executive Officer of the Commonwealth Healthcare Corporation, Esther Munoz, joins us live now from Saipan. Good morning, Esther. Thanks for joining us.
Good morning. Half a day, Tiro.
And so I guess we can just start with some of the good news that we shared on our Instagram, which is that vaccinations for kids 5 to 11 rolled out. We're sharing some of the images that Gil took for us over the weekend of some of the first kids. How's that going? I know we received 2,700 doses. What's your comment on that?
Well, we were actually very excited to start it, and we felt no reason to delay it. As soon as we got it, we just rolled it out to the multipurpose building, and we were actually very pleased to see a lot of people, bring their kids with them. There was about more than 100 people or 100 kids that showed up for vaccination. So I was pleased to see that. So. And especially with our cases here, the recent cases here in the CNMI, right? There's quite a number of individual kids that of course are ineligible to get vaccinated. Bringing it to the household, and we found a lot of our clusters really affected by the COVID because of the a lot of individuals that were unvaccinated.
And just wanted to share the most recent cases last night. One reported case. There are a total of 351 cases since the pandemic began in March, and 60 active cases. And you were sharing that most of them are experiencing mild symptoms, right? Of the 60 cases.
Correct. Yes. Mild symptoms. No hospitalization. Contact tracing actually found another 3. So we are, our active cases are now 63 from the community, and there was 4 from the travel testing.
And one of the things, CEO Munya, that you mentioned Friday's press briefing that got a lot of attention was the news of the possible index case being an essential worker. And one thing that you said that was really striking was we remind essential workers, you said, that if they're going to come to do essential work, they show love for this community. Where are you at now with that investigation?
So again, we have found a connection with our clusters. What we are looking at is obviously we never said that we were going to be perfect. We never said that we're going to get 0 cases in the community. The moment you open your borders, basically, there's going to be a risk. And we've been talking to the frontliners about what they need to do to protect their family, protect this community. And unfortunately, we have essential workers, and this, when you have an essential worker, especially consistently requesting and really doing essential work, as I mentioned earlier, it is there's certain things that need to be done for safety, for health, and we have to balance that out. So what we are looking at for the next step really is basically strengthen our testing strategies, and also working with the contact tracing. The contact tracing is excellent. They do excellent work. And with the lab and our nurses here, really working really hard to try to get our testing strategies strengthened, and we will continue to do that. And with the essential workers, I mean, there's just no way we're going to say no to essential workers, but we're just asking them that, you know, they come and do the work and work with us, and especially you know, when there's a case that we need to make sure that we try to contain it as quickly as possible.
Miss Esther, Chris, I wanted to jump in with a question about this index case. Are you able to confirm, because we've heard from multiple sources that the index case was an essential worker who originated from Guam. Are you able to confirm that?
Yes, I can confirm that.
I'm sorry. I apologize for our people over here. I do, ma'am, because it just seems like every time there's an outbreak of the NMI, it's coming from someone who's coming from Guam. So I want to go back to what you said about having, what was it, love for the community? Or?
Yeah, Esther, and I thought that really struck me in the press conference where you said, please show your love. I mean, oftentimes, I guess in a public health conference, you don't hear love being spoken about, right? But
unless it's STDs or something.
But I think it was so right for the moment, because if you were in the CNMI, right, the community transmission cases until then weren't detected until 200 days, right, or haven't been detected in over 200 days, and that just really hit home for me, for that message you gave.
Yeah, I mean, you know, I mean, we're grateful that it's not widespread transmission right now. We can confirm that. Again, these are cluster cases. The contract, you know, I mean, the contact tracers are really good at what they do. You know, we always said that we always need an army of contact tracers to battle this. And you know, one of the things that we did back in 2020 and even now, our vaccination rates, just like Guam, is really high. I believe we can, you know, especially with the mild cases that we're seeing, that is evidence, right, that vaccinated individuals can have these. They definitely can contract it. They can transmit it, but we do have our mild cases. There's 0 hospitalization so far. You know, we have the treatment for monoclonal antibodies. We did give for those in isolation right now, and they're recovering really well. So it's working. You know, the system that we have now. You know, we have to move from where we're at. We were, you know, looking at our testing strategies, contact tracing, vaccination, and we're so glad that the vaccines for children was approved quickly. It's almost like a perfect time, right, for it, and we just rolled it out. And you know, this is what we need to do to save lives. And I believe that moving forward, we can. People here are still having functions, so that's something that's you know, there's fear, but there's also people, I think, that understand the need that eventually it'll come to the CNMI, and we just need to protect our community. So we're at that stage, I believe.
Ms. Esther, I wanted to ask just a bunch of questions, really, but I want to start with this kid vaccination effort. Are we like in the same group chat here? Because you guys rolled it out over the weekend, and then we had a public health conference with Guam Public Health here last week, and it sounded like they were still drawing up the plans to roll out the kids' vaccine effort. So how are you guys able to get the kid vaccine so early, and how are you able to successfully plan for this rollout? Because it really seems like you guys are able to just turn on a dime. I mean, you did. I'm very just surprised and kind of floored, really, just to compare and contrast what's going on with you guys versus what's going on with us. And you're right. I heard you say 2 words that we don't really hear a lot from the response in the pandemic here in Guam, which those 2 words were save lives. So crucial. This kid vaccination effort. We're seeing high numbers of positive kid cases on Guam, right? We've had the MIS. So I got to ask, what's your secret?
There's no secret sauce. But you know, you did mention about you know, how did we roll it out? You know, that was your question, right? For us, I guess I'm not only the CEO for the hospital, I'm actually also the health official for the CNMI, which is really my and work with Art San Augustine very closely, working with Lilian Posadas also, of course. So I basically wear their hats here in the CNMI. So it's, to roll it out, we may not have, we have staff from the hospital that wanted to participate, and we just put it all together and say, we have it. We already have a vaccination site already operating. We just needed to make sure, of course, that we do it in a safe manner, protecting children, protecting everyone that gets the vaccine. And so we, put the team together from the hospital and the public health services, and just put it all together. And, Esther Muña, CEO, says, let's do it, we'll do it. So, yeah. And the people here, honestly, the staff have been really working, really trying very hard, because, again, one of the things that we were doing from the beginning was that, I'm also a hospital, like I said, hospital administrator, and trying to make sure that I protect my staff. I mean, that's the key thing to do. In any disaster, any emergency, we have to protect our staff. So this is a collaborative effort from all over the health system that participates in trying to get it out. But it's just that we could do it. We felt that we could do it, and we just do it.
Right. And then the other thing I wanted to ask you is, because you talked about how we kind of share a similar vaccination rate, right? But that's about all we have in common, because after that, it really becomes a tale of two, of several different islands, in that we have the high vaccination rate, but I'm sure you're aware we're just now starting to crawl out of this 16, 17 week surge. Do you guys over there in the NMI at any time kind of look over at Guam and I know I don't want to make it awkward for you, but I do want an honest answer. Do you ever kind of look over here and say, like, hey, what are you guys doing? Or hey, why don't they try this? Or hey, why don't they do that? Because our response to this surge was very hands off. I mean, there were pretty much no restrictions of any consequence that were put in place. I mean, when you do look at the mandate that targeted the unvaccinated, it didn't really do anything to stem the positive cases. That did boost our vaccination rate. So is there at any point there, Miss Esther, where you kind of look over and just be like, man, God, I wish I could help, or offer advice or anything? Because Lord knows we've been in over our heads with this COVID.
Well, the CNMI does have Public Law 1363. Public Law, sorry about that. We turned it out. Public Law 1363, which really gives us, myself as a Secretary of Health, the authority to look at this situation, and working with the governor and his task force to implement, practices, mandates that are necessary to protect this community. We also have to look at how fragile our health system is. We have only one hospital, Chris, unlike Guam. We have only one hospital, and we need to protect our hospital also as well. People, for a long time, our people were delaying care, not even to the point where they don't want to go to Guam for a referral. And that was something that was really bothering me, keeping me up at night, because at the end of the day, I have to also look at other health issues here. And that's the important thing. And not this past briefing, but the briefing before with the press, I did mention that we need to look at all these, we need to go back to really addressing, diabetes, talking about comorbidities. We need to look at that, and we need to do everything possible to get back to business. I've always said that we have a hospital to run, we have a healthcare system to run. So yeah, we look at the surge in Guam, and we put our guards up, to try to protect this community. But at the same time, it's also trying to run a health system and trying to get back to business, because the people here really, really need it.
Thank you.
And Esther, I just wanted to also just follow up on the essential worker case. Are you able to share the status of that investigation? I'm sure after that news came out on Friday at the press briefing, lots of people were wondering about accountability for this individual who might have been the cause. What's your message to those who are wondering about accountability there?
Well, again, I think that that's probably the legal team that's going to have to deal with that. But for us, we are going to ramp up our testing strategy, get it, to the point where, and I have to talk again with the legal team as well. If people here, essential workers are arriving, let's say less than 5 days, because usually we test them 5 days, right? If they're arriving and leaving earlier, we need to find a way to ensure that we at least get the list of their contacts, and try even to the point, possibly even, finding out, individuals. And we're working with the system developers as well, to try to find a way to control this, that even when they leave, because they're going to leave, and they're not going to stay for 5 days, and we're probably not going to know that they have the virus. So what we're going to try to do is to at least find a way to test or do contact tracing right after.
And so the protocol for essential workers is, can you just clarify that for us? What is the protocol for an essential worker?
So they are supposed to submit a negative test prior to arrival. They have to apply online. They have to have a support letter from the employer or the business establishment that is supporting this essential worker to come and do work. And they are tested on arrival on a rapid test so that they can get back to doing their work. And but as we all know, sometimes we find these day 5 results of positive even after all that. And so that's what our worry is, of course, is that when they're not here for 5 days, we don't know. And so, it's just unfortunate, but that's the protocol. And then they're out there, they're supposed to have restricted movement. They're supposed to just go to work, go home or go to their lodging. What we found out from this essential worker was that they were actually thinking of attending a party. And so we did, bring them back to Kanoa, and basically said that, you're done. you got to go back. But, and decided to leave right away. So, again, I cannot, the only thing I can say is that I cannot confirm, of course, because we still need to know if that was the individual. But we can confirm that the contacts were somehow connected with this individual.
Wow. Just seeing the cases now. I mean, I think one thing that I chat with you and about too is how when we get these reports of cases, it's a bit scary because we haven't gotten these reports previously, but also the contact tracing is working, right? That's what also the reports say. Would you agree?
Yes. Contact tracing, the vaccination, it's working. That's the key. And so, we need to take this in a positive way and say, hey, this is what's showing. I mean, I have to say that, we cannot ignore the data that we're receiving now. We probably wouldn't have this data if we didn't have these cases, but we're looking at the data, and it's making our decision easier on what's next. So.
And speaking of what's next, lots of folks asking about how quarantine might change in the coming weeks. I know that's something you've spoken about, that a change is coming. Can you share anything on quarantine protocols for incoming travelers? We have to look at what CDC guidelines actually provide. And, there's the new Biden or the White House basically change in the protocols as well for international travelers, getting tested and getting vaccinated. And so we are going to look at that, and we are going to make the adjustments here. With our excellent testing, with our excellent contact tracing, I believe we can make some changes for the best. And again, it's about saving lives. So, yes. And Esther, I'm sure you're seeing this circulate all over social media now. The public notice of proposed amendments to CHCC school and childcare facilities. Apparently, there might be some vaccination mandates on the horizon for children or for school students. Can you clarify and shed light? Because the way that this is being shared is, I think, like it was a secret, maybe, but there's a public notice out, and you're soliciting comments for 30 days. So can we get clear the record on that and what these plans are?
Sure. So our board of trustees did approve the adding the COVID vaccines into the current law. The current law does require that students, if they're going to be attending school, they have to have a health certificate, and that requires that they get the vaccines that are, from measles, mumps, rubella, everything. We just added the COVID-19 vaccines into that. There's, we're receiving comments already. We were receiving comments over the weekend, and a lot are very favorable of it. Especially with the new vaccines that are being administered over the weekend. So there's no secret to it. I mean, it is something that's already mandated for all vaccines or other vaccines, and so adding this is really just an extra protection.
I'm sure you've seen or I don't know if you've seen it, but there's been some backlash, right, when it comes to mandating a vaccine that, some might be even more hesitant to for children. And just taking a look this morning at some of the posts that were shared with the public notice out, there were a few parents who are completely against this and want a choice. What's your message to them?
Well, these are safe. The vaccines are safe. They were not rushed. They were all tested, and there's data. Obviously, even FDA has given a unanimous approval. Let me just go back to that. FDA unanimously approved for the panel approved the vaccine for children. So did the ACIP committee. The Advisory Council for Immunization Practices. They also unanimously approved these vaccines. So I have no reason to doubt that it is not safe. And, where we have children that are a lot of, here I'm sure it's even the same with Guam. CNMI, there's multi-generation in a household. And when you have kids that are unvaccinated going to school, and an elder that is probably immunocompromised and cannot get vaccinated, this is a Chamorro traditional way of protecting your loved ones. So yeah, it is your choice, but you have to understand that it's also some people don't have a choice, and it's unfair to them. And I feel like we need to be able to protect others. That's what we're all about. I thought either you are going to help others, or at least not try to harm them, right? That's our always goal in life.
And just wanted to touch on one last thing before we let you go. Schools are set, the CNMI public school system set a target date for November 15 to reopen their campuses. I believe the Northern Marianas College, the NMTI, and also the Coalition of Private Schools might have earlier opening dates than that. What's your latest update on school reopenings, and have things shifted in terms of approach or protocol, given that the most recent community transmissions were identified on campuses?
Sorry, Thomas, can you repeat that?
Schools are set to reopen in the next week. Some schools are already reopening this week, I believe, private and public. What is the latest on protocols for that, given that the community transmission that we're seeing now was identified first at schools?
So we met with the PSS, officials, and we did tell them that there is guidelines already by CDC about what to do when a child has been confirmed as positive. There's steps for that. The private schools are back. They have mitigation efforts already in place. They're already, there's practices already to address situations like this. And so we, going back to the vaccinations, we need the schools to open for us to be able to roll out to the school-based clinics. We need to do that. So, it is not just the left hand doing something. You have to do something else on the right hand and really try to work together, because this is we want the schools to open. There's definitely preventive measures that can be implemented, and they can do it. So I'm hoping that they get back to schools as well.
And just a quick follow-up on the MAB treatment, the monoclonal antibody treatment. You said so far you've only given you've only treated 4 patients with that. And how many?
This cluster only.
Sorry, what was that?
From this cluster only.
Okay, so how many do we have in stock, and are we prepared to? What is the capacity for that treatment? And what is the what are the guidelines for someone to administer that? Because here, as we've reported here, there are strict guidelines for to receive the MAB treatment on Guam.
It's the same. It's the same. Our medical doctors. By the way, I'm not a medical doctor, but so the medical doctors had a nice. They did a webinar just specifically for the CNMI providers. We have that on the isolation site. So we can implement it right. I mean, use it right away. That's what our doctors have been using. There's, I saw the guidelines that Guam had issued. We are urging anyone with symptoms, even mild symptoms, to come to the ER. ER is our point of care for basically COVID detection as well as treatment. So it is, we want people to go and go to the hospital, our hospital, and get detected. And then if they have the symptoms, we will treat them right away. Even if they're in the isolation site, because they are in quarantine when someone is confirmed positive. They are in isolation, and the doctors are there to be able to provide the treatment. So there's no need to guess, whether or not you need it or not, or whether you need to go and seek treatment. Once you're already detected as positive, you are basically have the availability of a provider that can support you for that.
Esther, how do you guys? Because here on Guam we test about on good days about 1,000 people, and during the height of the surge, we were seeing anywhere on average from like 125 to even up to like 200 some cases. So how do you guys kind of make sure that when you identify those positives, you're able to really reach out and say, hey, do you want to get this MAB treatment? Because there does seem to be kind of a gap in our system.
So once a person is positive, we isolate them here at the Kanoa facility. There's, I understand some jurisdictions, and I'm not sure Guam does the same thing, is that even an individual that's confirmed positive, they're told to quarantine at home. We have to isolate them at the quarantine site. So that is, I believe that's the difference, is that the providers are there. So there's no need to second guess, to try to guess if you need it or not. The provider will discuss that with you, and they will offer the treatment.
Thank you.
All right, Esther, thank you so much. I know it's a busy time, more than ever, and thank you, and to all the frontliners. We can't say it enough for all that you do. Thank you so much.
Thank you, Thomas. Roll a face.
Let's see that Luta face.
Oh gosh. Okay.
Thank you, Miss Esther.
Thank you, guys.
Thank you so much.
Okay.
Take care. Bye bye.
I think we can see Tomasa blushing behind the mask.
Yeah. Well, that was a great interview. We did have some comments here. Kid vaccines will start on Guam November 20th. Yes. Rosemary comments, our governor of Guam, stated there are a lot of administrative steps to be taken before the 5 to 11-year-old vaccinations begin. She comments further, Miss Esther said it all. One hospital placed life as a priority to ensure all protocols remain in place. The majority of recent deaths could and should have been avoided. I thought that was interesting, her answer, basically, when I said, hey, when you look at Guam and kind of compare it to what has happened there, do you ever kind of scratch your head? And she didn't really answer the question, but what she did say is the way that their law is written, it really kind of centralizes a lot of the decision-making authority with her position, right?
With the public health official.
Which is how it should be. Whereas on Guam, it's like they got to run everything by the governor, and then they got to do a little video, and then they got to make sure that the messaging is on, what messaging there is. So that's definitely a huge difference. seems like Esther is able to move freely to respond to this pandemic.
Well, and also quite literally too, because their team were on the ground, knocking door to door in a safe way,
Yeah.
talking to people outside of Facebook and Instagram
About vaccinations.
about vaccinations, about precautions. They were on the ground having real conversations.
Yeah, meanwhile, in our island, the governor asserted herself as the public health authority, which, I mean, I guess is all fine and good, but the results not what we saw in the CNMI, and that's so crucial. I remember when the vaccine effort begun, they did go around and knock on doors and talk to people, not just to let them know, hey, come get the jab, but to also let them know and to address their vaccine hesitancy.
That was that strike team, right?
Right.
What was it? Rapid response team, strike team, something like.
What was it called, Tomas?
On Saipan or
Yeah. In Saipan, we did have the rapid engagement team that went down
On here, yeah.
at the different with the different mayor's offices.
Yeah.
Yeah, and that conversation continues. I mean, this mandate that they're going to have for school children is obviously something that people have a lot of things to say. And she addressed it head on, saying that this is something that
She said it's the Chamorro way.
Mm-hmm.
That I mean, you basically you got to do what you got to do to protect the monomco in the family, which that sounds pretty Chamorro to me.
Yeah, and one thing I know at the previous press conference, she was saying that the children's lives are just so disrupted, and so this comes at a time where people just want to get back to some normal.
We mentioned this last week, Chris, but here's an angle that has not been exploited yet in local marketing of getting tested, staying home, ultimately getting your booster, getting your shot, and everything. Chamorro guilt trip. I actually think that would be quite effective. I mean,
give me an example.
No,
Dave.
it's like we can say it now and we can laugh at it. Oh, that's funny, haha.
Wow,
But remember way back before, we're like, oh, what if you did something like you gave people money to get the shot? That actually came to pass. What if you did something where you scared the bejesus out of people about they did that? What if you,
what if you told people they can't eat out or
Exactly.
work out? Oh, wait, they did that too.
that lasted for about 4
Oh,
days
yeah,
and
yeah,
then
yeah.
everybody complained everything into oblivion.
It's still in place, Jay.
Yeah.
Well, and she was mentioning too, right? Esther Munoz was just saying that they're also looking back at a lot of the other health issues that exist that
Right.
make you more prone, to more severe illness as well. And so it's a holistic approach, right? There isn't just one solution to any of this.
Right.
Tomas, do you get the sense from your own interactivity or interaction with the community up there throughout the Marianas, right, that the messaging has penetrated more of the community than it has here? Because I know, and by no fault of anybody's, they just said, like Chris was saying, they had to make that strike team because they said with certain Micronesian communities here.
What was it? Was more economics, Jay. It's so
socioeconomic
basically what the mayor's council, and this lasted like all of 2 minutes, where the mayor's council, because this is when we're getting all these DOAs, and it was don't wait until it's too late, and so they had enlisted the mayors to go and kind of call everyone and encourage them to get tested. Yeah, but again, that don't wait until it's too late messaging kind of fell by the wayside when you have Adeloop coming out with a video every 5 minutes. It's hard to sustain an important message. So, it's like, don't wait until it's too late. And then it's like, oh, they're, dealing with abandoned vehicle vessels. So it's like when you come out with a message, it has to go out and it has to be consistent. And that's something that we definitely have failed at. And you can't argue with it because look at our numbers during the surge.
So when the community cases broke out, I was calling different offices, different people I knew that were impacted by, or potentially exposed. And I was really, are you okay? Or, what's going on? And this person goes, Tomas, we just care about each other. We understand what we need to do. So we'll do what we need to do for 2 weeks, and we'll see what happens from there. But we know how to take care of each other.
Now,
So this person was telling me to kind of like calm down, and
hey,
we're
relax
doing.
there, Tom. Relax, fella.
Because
Your Luta face.
I was just calling, being like, oh my gosh, are you shutting down, things like that? They said, yes, we're shutting down. We're taking some precautions, but we also know what we need to do, and we know how we need to show up for each other.
And Saipan, population-wise, is the largest of the islands in them, and their population is like what, 10,000, give or take?
50,000.
50?
Yes.
Okay,
for the last census update, at least.
Yeah.
But with that 50,000, it is also. I'm sorry, no, it's 10 miles long, 50,000.
Yeah.
Right? It is a very diverse population as far as different ethnic groups, different age ranges, and everything like that. So messaging is is a challenge.
Yeah,
Not really.
I mean,
I mean,
so
look-
far they have 84% vaccinated, and I know that the public health officials would like to see that
Right.
be way higher than that.
But I mean, you can't really just argue the baseline. What's going on in the NMI is outside of the surge, which was caused by someone from Guam. Oh my God!
They're still doing an investigation.
Esther was just being nice, but it was caused by someone from Guam. How embarrassing is that? You wonder why a lot of them don't like us. That's exactly why.
You know what I would have really liked?
But what I was gonna say was, well, I just forgot. Go ahead, Jay.
No, I was going to say, you know what I really would have liked Esther to say? Because she goes, okay, and we found out this is a person. Yes, I can confirm that they were from Guam. We found out that they were trying to go to a party, so we basically brought them back to Kanoa, said, okay, you're done. I was like, I'm sure that's a very sanitized version of the exact conversation they had.
Maybe it was
I would
more
have
like,
loved to hear.
You're done. Make this guy a plate and bring it to the.
Well, we'll have
quarantine.
to see. I mean, obviously, if this is something the Attorney General at Matabusan is working on Guam, they probably won't be able to comment on
Yeah,
it, right?
yeah,
But we'll definitely have to check in with that legal team because, wow, I mean, an essential someone who's going
Disrespectful.
in, right,
Yeah,
who
yeah.
is getting exempted for this essential work.
Yep.
I mean, just it's just really tragic to me that this potentially could be the cause for this spike in cases. It's just how irresponsible. I can't wrap my head around it, Chris.
Well, I mean,
Dang.
look at it. This entire whole thing reportedly started with a single bet.
Yeah.
If you actually do want to trace the genesis
yeah,
of like
yeah,
this whole
okay,
thing,
I got what you're
but
saying,
yeah, but
yeah.
like
Yeah.
that.
But I
one-
mean, with the messaging with the NMI, you can't really argue that it doesn't work because, I mean, look at the results they got outside of the surge that was caused by someone from Guam, right? Whereas on our end, I'm pretty sure that we would hear just excuses or reasons all day. They would say, oh, well, we're dealing with 3 times the population or whatever. But messaging is messaging. It doesn't matter if you're messaging it to one person or, 10 people. You come up with a good message, saves lives, and you just beat the hell out of it until it's just people are just, I got to get my booster. That's what kind of messaging you want. But again, because so much of this pandemic response has to get filtered through the whole, like, we're running for re-election next year. I think that's where we're seeing a lot of the disconnect. I mean, if you look, there was a story in the media, local media this morning, interviewing Dr. Berg, who's the head of the Physicians Advisory Group, who came on here like one time. And they're already talking about easing up the restrictions. We get less than 20 cases, and already the conversation is like, all right, we're going to Christmas, you guys, no restrictions. So remember this place we're in now. Remember that there's 5,000 military service people coming to Guam this week, possibly more, to do training. The Chamber of Commerce is excited about this. They're like, hey, they're going to be out there. Show them the half-a-day spirit. And R&R, right? And so I just want to say, can we just move with some caution here? Because that's kind of what got us into this whole thing in the first place. Was this like herky-jerky, let's go from place of caution to, yay, Merry Christmas, everyone. You know what I mean? I'm just saying there's in my eyes, there's a perfect storm of vulnerability as we're still trying to get everyone to get their boosters. We're still trying to get the kids vaccinated. And now we want to talk about easing up on restrictions. Granted, though, the restrictions that are in place, that's what kind of made me chuckle, was they're ineffective. And so when we talk about easing of restrictions, they're saying that they're going to ease the number of people who can gather vaccinated, I'm assuming. I don't know if they're going to lift the restrictions on the unvaccinated, but I just think it's just a little too early. But hey, plan away. God knows we need some planning in this thing. 921, so that was Esther Munya, the CEO of the Commonwealth Healthcare Corporation. Really insightful that she kind of wears Lillian Posadas' hat and Art St. Augustine's hat. And that's what, according to her, they're able to kind of move quickly and make decisions on the spot. Good job, Tomas.
Yeah, and just again, shout out to the frontliners. They've held that line. They continue to hold that line since the pandemic started, and it's unfortunate that this essential worker
Who's
wanted
from
a party
Guam.
plate so bad
I know, God.
that he couldn't follow the rules.
Well, you guys got stuff in Saipan that we don't always have on the table in Guam, so I'm pretty sure it was the Azuzu. Right. He didn't want to miss
season?
It's 9:22. Hey, we're going to take a quick break, and my buddy Jason is coming back with a great interview. Jay?
Yeah, so we got Roland Atta from the Veterans Commission going to talk about this week's honoring, and not enough is being done to honor our veterans for the commitment they made, for the sacrifices they made, for the pain they endured, for the struggles that they continue to face. And what we can do as a community to right this wrong and make sure that we take care of our vets, because God knows they all busted their butts to take care of us. That we can sit here and we can jibe and criticize and do stuff on a talk show when people for generations, so like especially like our uncles, our ninos, our grandfathers and everything like that went into harm's way and served their country.
Thank you for that, Jay. We'll be back with more of The Link next.
Tacos
This
and
year,
music.
Giving Tuesday falls on November 30th.
And though our community is still facing some of the most challenging of times, there's no better time
To volunteer, donate,